Well, welcome everybody, and I hope you're all enjoying this lovely Scottish weather that we've got today, but keeping safe in the process. Thank you so much for everyone who's joining us today, and hopefully we'll have some people join us at a later stage. We totally understand that operationally, occasionally we don't always kind of keep to our timelines. So today, this is one of the first webinar as an introductory webinar to ones that we hope to have over the coming year. Today, the focus of this webinar is to get to know who Falkirk's Public Protection Chief Officers are, because it's the Public Protection Chief Officers group that is supporting the webinars as we go forward. So we're going to hear, hopefully, about what the strategic direction is for the Chief Officers in each of our areas. So the areas being police, health and local authority. And also just having an understanding of what people's views are and what supports that we can expect from the Chief Officers as practitioners in this area. As you will see, there's quite a number of individuals coming on to the call. We're hoping there's going to be about 200. Just now, I think we're sitting at 131. And to support us and enable everyone to get the best from this, therefore, we have shut down cameras and we've shut down microphones. And that's really just so that there's less disruption during the call. We will be recording this call and it will be available on the practitioner web pages after, and that's for those who are unable to join us today. When we are speaking, the Chief Officers or anyone that's presenting today, they will be will come off mute and will be allowed to speak. We have asked for a number of questions to come in prior to the event, and we have received those. So hopefully today we will pose them to the Chief Officers. The Chief Officers today are Kenneth Lawrie, Francis Dodd from NHS Forth Valley. Kenneth, of course, is from the local authority in Falkirk. Sorry, Kenneth, you came as if you didn't need an introduction there. And Roddy Irvine from Police Scotland. But I will introduce them as each individual is about to come on and speak. So without further ado, we'll just kind of go into an understanding of the webinar agenda. So the webinar agenda is, oops, sorry, I'll just skip a slide there. The webinar agenda is we'll have presentations, as I say, from the Chief Officers. We'll then go in and hear from our lead officers about the joint work of our Child and Adult Protection Committees, and then we'll have some question time. That's when we'll be able to share the questions that have been provided to us by yourself, but also you're invited to maybe add comment or questions into the meeting chat. We're very conscious that because you're on mute, you'll not be able to speak, but if you put that in the meeting chat, we will take those questions and we'll respond to them later on after the webinar. We do have a limited time, so we won't maybe be able to answer everybody's today, but hopefully you'll get the questions answered in due course, and then we'll do final comments. So without further ado, I'll hand over to Kenneth. Now, Kenneth's introduction is a graduate from St Andrews University as well as Strathclyde Graduate Business School. He has worked in a variety of different areas, public and private sectors as well as local government, and that started in the 90s down in Dartford. So Kenneth does bring to Falkirk a real broad range, having worked in England as well as Scottish Borders and Midlothian as well. So really, we'll just introduce, say hello to Kenneth, and we can take it from there.
Thank you, Jilly. Afternoon, everybody. Really pleased to be with you today and have this opportunity to talk with you and hopefully to answer some questions as well. And perhaps just might take this opportunity at the beginning to personally thank you for all the excellent and vital work that you all do to safeguard and protect our communities. I've been chair of the Falkirk Chief Officers group for 6 years now. I was joint chair of East and Midlothian Chief Officers group for 9 years before that. So I've been involved at this level in public protection work for a long time, and it's something which is of great importance to me. I'm very clear that the public protection agenda is at the heart of what we do as a council and with our partners across the Chief Officers group. And there's nothing more important than protecting vulnerable people from harm in our communities, and that's what we're all about in this group. So in order to do this work effectively, it's essential that there's strong and effective connection between the leadership, the strategy, and the operational practice. And we want to continue to strengthen this area. So this first COG event takes the opportunity to share with you an understanding of what COG is and how it operates. And chief officers have individual and collective responsibilities for the protection of children and adults in our communities. And you'll hear a bit more about how this works and how it connects from the various speakers today. So I hope the insights from today provide you with some real reassurance that the issues we know to be important to you and the impact on your area of service are reflected and considered at the COG. For example, we're all facing issues regarding capacity due to workforce pressures and the complexity of need. And that is routinely reported into the COG and allows us to focus on impact and on risk mitigation. Chief officers have a collective responsibility to ensure that public protection activities are appropriately resourced, including staff time and finance, to fulfill the agreed annual improvement and business plan and related objectives. And we do take our responsibility in that regard very seriously indeed. So I'm going to move on to the next slide, which shows the public protection group responsibilities. So as you can see, the responsibilities for public protection are outlined on the slide, which I hope you're all seeing now. But in order for us to do this, how does it operate in Falkirk? Well, Police Scotland, the NHS Board and local authority chief officers are individually and collectively responsible for the leadership, direction and scrutiny of their respective public protection activities. And we work together to ensure effective collaborative working to discharge our responsibilities and consistently promote effective joint working within and across services. The work of COG ensures local arrangements operate effectively to ensure that we protect children and adults in Falkirk and to support the themes of the Falkirk Plan. And I'll come back to that shortly. Optimal conditions come from partnership working, good and effective communication and common priorities. We know the importance of that from numerous learning reviews over the years and our collective focus on improvement. So the partnership is reflected within the COG, and it comprises of the Council Chief Executive, myself, the NHS Forth Valley Chief Executive, and a representative of Police Scotland C Division on behalf of the Chief Constable. In Falkirk, this is the Divisional Commander, Roddy Irvine, and you'll hear from him later in the presentation. Alongside us are senior officers from a range of agencies and organisations who attend and support COG. Amongst those who attend are the Chief Officer of the Integration Joint Board, the Chief Social Work Officer, the Chair of the Adult and Child Protection Committees, together with the Chair of the Alcohol and Drugs Partnership, MAPA Strategic Oversight Group, and the Gender-Based Violence Partnership. I'll talk a little bit more soon about what COG looks like in the business of our meetings, but right now let's take a look at what our local vision and drivers are. So this slide shows our vision and priorities. And our vision is a statement of the long-term impact that we as partners want to have. The vision matters because to stay motivated, we all need that sense of common purpose and common connection and looking at a future that is compelling to all of us. Our COG vision encompasses our determination as a partnership to reduce the risk of harm to those who live in our communities and reflects the title of today's webinar. It's straightforward, it's values driven, and it's ambitious given the multifaceted and complex nature of risk and harm to people. Given its importance, I'm going to take a second just to read it out to you. So, Falkirk's vision for public protection is to actively promote multi-agency partnership working, which reduces risk of harm to babies, including unborn infants, children, young people, and adults who live in our communities. The Chief Officers Group reports annually to the Falkirk Community Planning Partnership Board. So I'd like to let you know a little bit about the CPP as it's known. Community planning partnerships bring together public agencies and the third sector to work to improve the lives of people in our communities in Scotland. They work on local improvement plans, which may directly impact on public protection issues. CPPs are responsible for producing plans to describe their local priorities and planned improvements. And the Community Empowerment Act Scotland 2015 places a duty on each area CPP to publish a plan identifying the greatest inequalities and how we collectively, as multi-agency partners, plan to tackle them. The Falkirk plan, which you can easily find in full on the internet, was developed between October 2020 and 21, during which time there was a review of local data, an extensive period of engagement with residents, and a review of local policy and projects that impact the issues that were found. It was approved by the Community Planning Board in 2021, and the work of COG and all of the committees and groups which report into it supports all of the Falkirk Plan themes, all 5, which are shown on this slide. Later this month, I'll present the update report on all of COG's work to the CPP board. There'll be scrutiny from partners in that forum and recognition given for the commitment and the work being done by all of you to safeguard and protect our communities in Falkirk. So briefly, this next slide shows you how the CPP is configured. You can see how COG and other groups supporting the CPP and the Falkirk Plan themes report into the board, which is chaired by the leader of Falkirk Council. And I think it's worth saying that we're always keen to improve the work of the Community Planning Partnership. Self-evaluation is a key tool in that to ensure that as public sector leaders, we're doing all we can to help our organisations and partners deliver good outcomes for the people and communities of Falkirk, that we're really adding value and making a difference. Okay, moving on then to the responsibilities across the lifespan. Public protection, as you know, is a generic term used to describe a range of local structures to respond to child protection, adult support and protection, gender-based violence, and high-risk offenders. I've talked about the groups and committees that routinely report into the COG. Here they are represented on this next slide, and some of you will be members of these committees or the subgroups which support them. To realise our public protection priorities, we need to work effectively together as part of a whole system. Within public protection, a whole system approach involves collaboration and robust governance structures, which consider our local context to shape strategy, processes and practice. Applications of systems thinking should enhance linkages across the public protection agenda. For example, the interaction between gender-based violence and the impacts of poverty and past trauma on mental health and alcohol and drug use. And many of you will see these connections in your work on a daily basis. COG recently supported the establishment of a new public protection lead officers group to make best use of our capacity and resources available. And this is a good fit with our drive for a whole system approach, recognising that children, young people and adults live in families and communities and require us to focus on protection right across the lifespan. So briefly, and this is my final slide before I hand over to the local police commander. This is the agenda for our next COG meeting. We meet 4 times a year, and at every meeting, reporting groups provide detailed updates on the activity across each area. The business agenda changes with each meeting. We're never short of business, and we're confident that the right business is in front of chief officers to support the work that you and others are doing all across the public protection landscape. One thing we have developed recently is a risk register. It's an important development for us. The reporting groups and committees refresh and stay abreast of their own risk registers, which reflect changes that present risk from vacancies, from new legislation and policy, from single agency changes, and from learning reviews. Okay, I think that's enough from me. Thank you for the opportunity to speak to you. I will be back later to answer some questions, but control will now be taken over by Roddy at this point. Roddy.
Thank you so much, Kenneth. So, Roddy, before you come in, I'll just introduce you. So, Roddy is our Chief Superintendent who has joined us quite recently here in Forth Valley. Before joining us, he's got over 20 years' experience in the police force and has went through the ranks in various guises within Glasgow, Lanarkshire, East Northamptonshire and Tayside. Throughout his career, Chief Superintendent Irvine, sorry, I've demoted you there, has always remained a strong believer in working in partnership and is attuned as well to the differing local needs for each of the areas that he's worked in, and that will be the same here in Forth Valley. I will do. I'll just hand over Roddy, because I'll go on for a long time, kind of all the experiences you've got. So I'll just hand over to you to take over. Thank you.
Okay, thanks very much, Jillian. And thanks very much for inviting me to speak to this very important group of practitioners today. As hopefully the introduction alluded to, I've spent the vast majority of my career in local policing, and I've served in an operational role in local policing at every rank. I was previously the divisional commander in Lanarkshire, so I suppose you could say this isn't my first rodeo, and settling into Forth Valley very well. My first question when I arrive in any new local policing area is, what's the partnership working like? Because it's so important to what we do. And I would echo Kenneth's point that public protection is at the very heart of what we do. And that's a view shared across Forth Valley Division. I've seen many changes over the years that I've served in the police. I remember in the division that I started in, the family and child unit, as it was called at the time, was 2 officers bolted onto the CID. Now the public protection unit is bigger than the CID, and that's exactly as it should be, because public protection is our most important work. And it's the area where partnership working is most important to delivery. When I talk about partnership working, I mean both internally within policing and externally to us across the multi-agency structures. So just to explain a little bit about the policing. So looking internally first, public protection affects all areas of policing. Our uniformed response officers, they're the people who are attending at incidents where they encounter domestic abuse and incidents which have an obvious public protection theme. And importantly, they're our eyes and ears. They encounter the child who is subject of abuse or neglect, and they either take action themselves or pass information and intelligence into the system for it to be addressed by our specialists and potentially our partnership arrangements. Internally, our intelligence functions are continually researching and developing that information and intelligence into a product that can form the basis of unilateral or multi-agency action. I think that dealing with vulnerable people is some of the most challenging work that police officers and staff encounter, whether it's those frontline officers or the specialist public protection officers that Barry, who's on the call, leads. One of the biggest changes I've seen, and one of the most positive changes I've seen, is the partnership working in this area. And certainly we in the police couldn't achieve what we aim to achieve without it. But for the purposes of this presentation and our first webinar, I'll focus on giving an introduction to the police and the police public protection structures and teams. So in Police Scotland, there are national and local public protection unit functions. And if I drift into sort of 3-letter acronyms, such as PPU, that means public protection units. So at the national level, the team's logically named the National Public Protection Team, and they're responsible for producing guidance, standards, and national policy. So where there's new legislation, for example, they'll lead the development of the operating procedures to allow local divisions to deliver against that. The national team also own the training of specialist officers and the development of that training to ensure it keeps up to date with legislation whilst incorporating learning and best practice. They also link in with colleagues from out with Scotland to make sure that any of the learning that's happening there is brought into Scotland. There are also operational national teams, and they cover domestic abuse, child protection, adult protection, rape and sexual crime, and attendance management. They really mirror our local teams, but at that national level, and they'll typically take on the more complex and protracted inquiries, including inquiries which span multiple local policing divisions and multiple local authorities. They also tend to take on the MATAC targets, multi-agency tasking and coordinating, who are the most serious and dangerous domestic abusers, with close support from the local public protection units. National work's ongoing to review the public protection operating models across Scotland and look at our processes and practices in terms of efficiency and effectiveness. This is especially important due to our ever-increasing public protection demand and the requirements of developing legislation. We should start to see the benefit of the output from that work towards the end of September, but that hasn't stopped us from reforming locally, and I'll cover that later in the presentation. So a quick outline of what the division looks like. So we cover the 3 local authorities of Falkirk, Stirling and Clackmannanshire. There's 1 divisional commander, me, 3 uniform superintendents covering operations, which is basically uniform policing, support and service delivery, which is our corporate functions, and there's a dedicated partnership superintendent. We also have 1 detective superintendent with responsibility for public protection and reactive CID, and the 3 local authorities uniform policing is covered by 3 area commanders. And we have 2 detective chief inspectors covering PPU and CID, and overall our establishment is of 561 officers. So very quickly, the setup of Forth Valley PPU, the teams and their remit. We've got 1 DCI, as I mentioned, that's Barry McDade, who's kindly operating the slides for me just now, and 5 detective inspectors who lead on 1 for child protection and adult protection, 1 for rape, serious sexual offences and domestic abuse, 1 covering the concern hub and safeguarding, and 1 for Forth Valley child interview team and interagency referral discussions, and 1 for the sex offenders policing unit. The teams are relatively small considering the work that they cover, and they definitely punch above their weight. Below the detective inspectors, there's 9 detective sergeants who supervise 24 investigating detectives who provide 7 days a week cover, 10 officers who manage the registered sex offenders and restricted patients, 5 officers who manage the IRDs, child protection planning meetings, adult case conferences, and care and risk management meetings in respect of high-risk children. We've got 3 officers in the safeguarding team whose remit is to manage DISTAS, the domestic abuse disclosure applications, MATAC, and multi-agency risk assessment conferences that you might know as MARACs, focused on ensuring the safety of the highest risk victims of domestic abuse. We've also got 4 officers in the Forth Valley child interview team and 6 officers reviewing and sharing vulnerable persons forms. And we have 5 members of police staff who support the teams. In terms of the PPU restructure, in May 2023, the Public Protection Unit in Forth Valley underwent a restructure due to the changing landscape of public protection, changing statutory requirements and the tools and processes available to police officers to protect the public and prevent crime. The restructure meant closer integration of the child and adult protection investigation teams and the rape and domestic abuse investigation teams. And the restructure put a focus on the creation of safeguarding teams to review and support all the domestic abuse incidents and all the functions that I mentioned above. This allowed officers who were investigating crime to focus on those investigations and ensure those who were responsible for safeguarding were able to focus on safeguarding. It was also intended that the renewed structures and processes would provide greater consistency of staff to work alongside our partners, whether that was in terms of consistency of personnel or consistency of working hours. So the Forth Valley Child Interview Team launched in February of this year in close partnership, and already we're seeing more trauma-informed support and trauma-informed practice to support the UN CRC and provide better evidence to bring offenders to justice. We've also had a short life working group in respect of missing people, and that's seen a reduction in missing persons episodes and enhanced partnership working and planning for care experienced children. And those reduced instances of missing persons is reduced risk to missing persons. One thing that we're really focusing on just now is awareness raising in cases of sextortion, which we're seeing more and more. And that's now being rolled out, and work is ongoing to continue this across the partnership and to ensure we educate as many people as possible, because education that sextortion is, people who experience sextortion are victims. A lot of the victims are children, and quite simply, this is child sexual exploitation. We want to educate potential victims, parents, and also reduce any stigma so that people feel comfortable to report and get support. It's absolutely about prevention. As I mentioned before, operational officers have a significant role to play. And I'd also like to mention the good work of our communities teams, our school-based officers, and our divisional alcohol and violence reduction unit, who support the PPU and the wider partnership, whether that's with educational activities, for example, the school-based officers in schools and the community teams, or the apprehension of perpetrators. And lastly, but by no means least, I'd like to mention the well-being of our officers and staff. I certainly recognise that this is a very, very challenging area of business, which can have a significant impact on our people. And we in Forth Valley are doing our absolute best to protect our people. So to summarise and close, the future remains one of working together and looking at how we can support each other to deliver our collective goals, to support our communities and the most vulnerable. So thank you again for the opportunity, and thank you very much for taking the time to listen.
Thank you so much, Roddy. That was excellent, and both, I'm sure everybody will agree how informative it is to hear both from yourself, Kenneth, and Roddy there about Police Scotland. We're now going to move on to Francis Dodd, Professor Francis Dodd, who is from NHS Forth Valley. Just a wee brief synopsis of Francis's career. Francis commenced her nurse education in NHS Greater Glasgow and Clyde, and was there for majority of her career really before going to NHS Lanarkshire. Francis has held a number of clinical roles as well as operational and senior professional leadership roles. We were really fortunate that Francis chose to come to NHS Forth Valley via the Scottish Ambulance Service. And here in both the Scottish Ambulance Service and in Forth Valley, Francis has got a real broad range of expectations on her role, and mainly around about quality, professional practice, ensuring that we deliver person-centred care and that the patient experience is upmost in everybody's mind. Public protection comes under Francis's remit, and she is the executive leader for NHS Scotland, Forth Valley, sorry, not Scotland, not the whole of Scotland, NHS Forth Valley, but in this regard. So I'll just pass over to Francis.
Thanks very much, Jillian, and thanks for the opportunity to speak today. As Jilly said, I've now been in NHS Forth Valley for the last couple of years, and I'm here representing Amanda Croft, who's the Interim Chief Exec in NHS Lanarkshire and is unable to be here this afternoon, so I'm standing in her space. But I'm also a member of the COG, so involved with Kenneth and Roddy in terms of the work that we do across Forth Valley and the Falkirk partnership to support the communities in relation to public protection. So you can see here on the slide that NHS Scotland has been under the responsibility to work to this accountability and assurance framework, and this came in late in 2020 in order to make sure that the public protection services and arrangements within NHS Forth Valley met the needs of the population. You can see a high level number of responsibilities for NHS Forth Valley to comply with, and we have done a huge amount of work to achieve these. However, I think it's fair to say through the work that we're doing in NHS Forth Valley, we still have got some work to do, and we've got some way to go in terms of our ability to provide the level of assurance both internally and to other partners that we have got our arrangements where we need them to be. What I'm going to do today is just to describe to you where we're at this stage, with the recognition that we still have further work to do. You can see from this slide that there are significant responsibilities, both in terms of supporting communities, but also supporting staff to identify vulnerability, whether it's for adults or children across our organisation, and also to make sure that the conditions are right for our staff to both be engaged with the public protection agenda, as well as understand when and how they are able to raise concerns and how we can potentially support them to raise those concerns and protect our population. In terms of where we have got to within Forth Valley, we have restructured our systems of assurance in terms of the dedicated leaders that we've got in relation to public protection. I've got responsibility, as Jilly suggested, as the executive lead for public protection, and I would be lost without the people that I'm just about to talk about in relation, and you can see them on this slide. So Jilly Taylor is the chief nurse, but also it supports me in terms of the work of the wider legislation in relation to public protection, and coordinates with Lorna Hood, the nurse consultant for child protection, and Jane Scaife, the nurse consultant for adult support and protection, the work that we're doing in Forth Valley to make sure that NHS Forth Valley meets its statutory responsibilities in relation to public protection. We also have Dr. Christina Bohumova, who is one of our consultants in paediatrics, who is the child medical lead for the health board, and we're currently recruiting GPs, clinical leads, and as well as the option to recruit some care of the elderly clinical lead expertise in the adult protection space to try and support the work that we are doing to strengthen the child and adult protection arrangements across Forth Valley. In each of these roles of the staff who work in public protection across the organisation are to offer that strategic corporate leadership as well as operational support to all of the staff, and to ensure that the necessary reporting arrangements and accountability and governance arrangements are in place to meet the needs of the population. There are a huge number of staff who will come up against instances of adult or child protection concern, and it's what we're trying to do is make sure that those public protection remit is absolutely across the whole of the organisation. And we'll talk a wee bit as we come on to later on, just in terms of what the governance arrangements are, and making sure that all of this central element of the functions of all of our staff have got public protection absolutely front and centre in their mind, irrespective of where they encounter potential vulnerability of children, young people and adults across our communities. The leadership team and those with the dedicated roles are there to ensure that all staff are safe and competent in their practice in relation to public protection, and that practice is governed. But also it's making sure that they are able to seek advice, seek support, and seek guidance in terms of what to do next. So that's some of the work of the team that we've described to you there. In terms of the governance arrangements within NHS Forth Valley, we've got a child protection operational group that Lorna Hood leads up, and we've got an adult support and protection operational group that's led up by Jane Scaife, and then I lead the Public Protection Assurance Committee, which reports up into the Clinical Governance Working Group and up to the Clinical Governance Committee of the board. So public protection practice is audited and monitored and reported by the chief nurses and managers throughout NHS Forth Valley. Operational activities are monitored and improvements led by Lorna and Jane, supported by Jilly across the health board. And this is then reported into those governance arrangements as I have described. And this is where it flows absolutely into the normal governance arrangements, where many other aspects of clinical governance are seen through the health board's lens. But the importance of the strengthening of the public protection arrangements has been the focus for Jilly, myself and Jane and Lorna over the last 18 months. In terms of the staff that we have across NHS Forth Valley, we have got a number of learning resources available to them, and we use the TURAS platform, which is our internal online learning mechanism for Forth Valley staff. There are general modules for public protection, as well as more specific modules for child protection and adult support and protection. All staff are mandated to complete these modules and to engage in multi-professional learning sessions. As we all know, multi-professional learning is essential, as those who learn together work better together. And I think what you see today and you hear today is the importance of that interagency working to be unrelenting in our pursuit of robust public protection arrangements across Forth Valley, in particular in the Falkirk area where we're focusing today. And that's the kind of underpinning concept of what we're trying to portray in this webinar, but also in webinars as they come through. Within NHS Forth Valley, we're in the process of developing a public protection learning and education strategy that will be based on those national recommendations that I described earlier, and will provide specific details about what learning and at which level staff and services should undertake and how frequent that learning should be. And this will be published at the end of this year. As I described to you earlier, we continue to evolve the arrangements within NHS Forth Valley and make sure that we meet our equal responsibilities in the partnership across that interagency collaboration and cooperation, but also that we have got the staff who are out across the system identifying this level of vulnerability. Finally, members of the Chief Officers Group are fully aware of the important and often complex and quite challenging and difficult work that the professionals who work in public protection have to deal with across their day. And it can be particularly challenging in terms of how they meet the needs of the population. So as Roddy said earlier, we provide clinical supervision and support, but actually making sure that we've got that restorative supervision to provide evidence-based practice, and also to make sure that the well-being of our staff is maintained throughout that time. There's a huge amount of work goes on in the background just to work through these difficult and challenging cases, and also to make sure that the staff who are dealing with those have got the right infrastructures of support, guidance and reporting arrangements, just to make sure that all of that is absolutely in place. We can't express enough how grateful we are for the passion and compassion that the teams who are out there doing this work show every single day dealing with these challenges. And we are aware that these can be really fraught and uncertain and apprehensive times, and difficult to deal with. Our challenge is to make sure that we get that level of support right, and to encourage all of you who work in this space to seek support and supervision in each of your own respective employing authorities, and also making sure that that multi-professional, multi-agency working environment is as supportive as it can be. Support and supervision can be undertaken in many ways: multi-professional action learning sets, or peer support, or structured supervisory discussions, or one-to-ones, or across the organisations. But the important thing is that those reflective conversations and discussions happen in a timely manner and that our staff are supported in this really challenging work. I think I said it earlier, but we encourage you all to take care of yourselves when working in this area of practice, and please be confident to ask for what you need as often as you need it, or to take up the offer of routine supervision, whether you think you require it or not. Just think of this as a maintenance dose of support that will prevent you from feeling challenged. I'm going to pause there, and I'm going to hand over and stop sharing and hand over, I think, to back to Jilly. Thank you for your time.
Thank you so much. So there's quite a lot there. We've heard both from Kenneth, Roddy and Francis. Can I encourage everyone, people have been very quiet, which is very unlike us that work in the public protection area. Can I ask you to pop comments and any questions that you want to ask of our chief officers in the comments section, and we will pick it up. And as I say, we'll either, if we have time, we will answer those questions at the end of the session, or we will send out answers later on, to us all on the web pages, etc., or via email. Okay, I'm now going to hand over to Gemma Ritchie and Tony McLaughlin. Gemma, a lot of you will know Gemma. She is the lead officer here for Adult Support and Protection in Falkirk, and has been for the last 5 years. Gemma is a social worker and mental health officer, and at this current time is chair of the National Social Work Scotland ASP subgroup. Tony McLaughlin, again, you'll be familiar with Tony. Tony is a social worker and joined Forth Valley. I was going to say that's actually just my habit. He joined Falkirk as the lead officer for child protection, and has only recently moved from that role into be an interim locality manager. Obviously, Tony, as we've all experienced in meeting him, has been an integral member of interagency partnership working, and tries to connect strategic observations to practice. His main focus is relationship-based practice. Now, I'm sure Gemma and Tony will come in and tell us more about themselves, but I'll just hand over to yourselves in your presentation. Thank you.
Thank you very much, Jillian. Okay, folks, so we've heard from 3 of our chief officers from our core public bodies, but as you'll know and expect, when we've talked about partnership working throughout the presentations that we've enjoyed so far, that's not all the agencies that are involved in this important work. So I'm about to launch a quick poll, which you'll be able to participate in. And I'll just do that for you just now. Okay, so you should see a pop-up that has appeared on the front of your screen. If you haven't, for whatever reason, you can access it in the chat. And what we're just really looking for you to do, you can submit as many responses as you would like. We're just looking for you to name partner agencies which provide membership to Falkirk's child and adult protection committees. And this is going to create a bit of a word cloud for us here, folks. So as many responses as you like. Just trying to name some of those other partner agencies that contribute to the work of our committees. There we are. It took a wee while to update itself there. I just saw Police Forever, and I was thinking, I've surely got more responses than that. We can see them populating now. Lots of different services being mentioned there, from the voluntary sector, all the different sectors that are so important to this work. Children's services, midwifery services, mental health services, Scottish Fire and Rescue services. Perfect. Education, adult services, justice services. Great. Okay, thank you. Thank you for participating in that. I'm just going to move on to our next slide and just close that one for you just now. If you do want to go back and revisit that, it's available in the polls tab. Okay, so I think we captured nearly everything that's represented in this slide here. Now, Tony and I have put this slide together here just to show you the overlap and the cross-cut in with the membership across our Child and Adult Protection Committee. This is vitally important. It makes sure that we're able to share, we're able to influence, we're able to work together, and importantly, across the lifespan, as we've already talked about today in the focus of this webinar. So within the sphere here, you'll see right at the top there is our independent chair. Our independent chair of our Adult and Child Protection Committee. It's the same independent chair, Alan Small. Extremely important role, and is also a member of the Chief Officers Group. So again, you can see where those connections will be made. Within this slide, you can see, so everybody that's in the sphere are members of both of the committees, but then the Adult Protection Committee has some unique membership. So you can see there's Justice Service, there's Independent Advocacy, Scottish Ambulance Service, Scottish Fire and Rescue Service, and the Department of Work and Pensions, who've really come on board really valuably actually since the onset of the pandemic, where they set up new specific roles to focus on the needs of their vulnerable customers. And on the child protection side, you can see their substance use services, the Scottish Children's Reporter, and education. But similar, mostly the same membership with some of those unique ones. And although those are unique, our subgroups, which we're just about to go on to, actually there's membership that includes some of those ones that are unique to each committee. So before I hand over to Tony, just to touch on a couple of important bits around the work of Adult Protection Committee. We're absolutely required. It's something that we must do. This is set out in legislation. It's a statutory basis that the council and the local authority, we must establish an adult protection committee, as you can see there. The bottom 3 bars there, it touches on some of the things that it says in the legislation. So the legislation is 15 years old now. We absolutely do the things that are there, but there's so much more to the work of the Adult Protection Committee, which we come together on a quarterly basis, but the subgroups are really the engine room and taking forward the work plans. And you can see they're listed here for Adult Protection Committee. We have our continuous improvement subgroup who really work on policy, procedure, and our adult support and protection data. We've had a huge improvement programme for our data for adult support and protection over the last couple of years, where we're now reporting that on a quarterly basis rather than an annual basis, which is really going to bring us on leaps and bounds, because we'll be able to examine the needs of adults at risk of harm, not just looking back on an annual basis, but looking at that each quarter. And actually our plans to do that even more frequently, using data within our practice teams on a monthly basis. Communication, I'll not touch on them all here, folks, but because Tony's going to give an overview as well. However, I'll just touch on a couple of things. The communication and engagement subgroup, as you'd expect, part of their role is around public engagement. Roddy Irvine had talked about sextortion earlier on in his presentation. An example was the Adult Protection Committee. We led on a public awareness campaign for sextortion in February this year, when it was Adult Support and Protection National Day, which was very successful. We had the support of our partnership communication officers, and we're able to do some targeted social media advertising, which was very successful, and we hope to take that forward as well to raise awareness of these important and emerging types of harm. Escalating concerns subgroup really focuses on harm prevention. So a lot of what we do in the Adult Protection Committee is focused on adults at risk of harm, but it's focused on prevention. What can we do to prevent harm from occurring in the first place? And we work really closely, particularly examining some of the reporting coming through the Risk and Concern Hub through Police Scotland, to look to recognise escalation at an early stage and to think about effective and early interventions. But I'm now going to hand over to Tony, who's going to provide some more detail on the work of CPC.
Great, thanks Gemma, and I'll just forge straight ahead. I'm conscious that time is upon us. Folks, just giving an overview really of the work of the Child Protection Committee, as you can see on this slide. This CPC, as it's commonly referred as, it's our interagency strategic partnership. It's responsible for developing, implementing and improving our child protection strategy, and that's across and between agencies and within our local community. So the real aim of it is to support staff and members of the public to really in their collective endeavour to make Falkirk the best place in Scotland to grow up and to keep all children safe from abuse and neglect. The CPC performs a number of functions to jointly identify and manage risk to children and young people. It's focused on improving, monitoring and improving performance and promoting that ethos of it's everyone's job to make sure that children are all right. Now, the key functions are laid out in the guidance document that Kenneth referenced earlier, that protecting children. It sets out the roles and responsibilities of our Child Protection Committee and Chief Officers. It sets out the key areas, thematic areas around public information engagement, strategic planning and connections, and continuous improvement work, which you can see within that the substructure of the CPC there in the subgroups that are noted. Now, the roles and responsibilities of the key agencies involved in care and protection are set out in the National Guidance for Child Protection. It was updated in 2021 and just recently, again in 2023, there was a further update. And our CPC fulfills its responsibilities through our governance structure, which again, as I say, is noted there within the various subgroups, those multi-agency working groups that really drive the continuous improvement work of the Child Protection Committee. And that also is taken through the vehicles, is through our CPC business and improvement plan. Under Gemma, if you move on to the next one, if that's okay.
Has it moved on for you?
Not yet. I think we're still on the work of the CPC. I can start it. Okay. So Gemma's given you overview of the work of the Adult Protection Committee. I've given you an overarching view of the Child Protection Committee. I suppose the question lies, where are we at now? What does our joint work look like so far? So across 2023, 2024, it's included a range of activity. We've had practitioner forums looking at areas of commonality and spaces in which we've got a shared interest. That's included forums where we focused on criminal exploitation. We've looked at self-harm, human trafficking and exploitation. We also have communities of practice that have been developed that focus on interagency referral discussions. As everyone will be aware, that's our key vehicle for information sharing and decision-making in adult protection and child protection. We also have our joint and shared interest in embedding our safe and together approach. We've held an Adult Protection Committee and Child Protection Committee Development Day, where we looked at our existing processes in relation to responses to the 16+ age group. We've looked at national policy around about this area and legislation and how we can really build on our strengths, but also get better at areas where there are gaps. And it's been acknowledged on a national level, there are gaps in relation to that 16+ age group. There's often young people, particularly our care experienced young people, that can fall between the gaps of these services. So we've been doing a lot of work in this area to try and strengthen our responses. There's also high-level interagency training that's available across the lifespan. And we've got a lot of work that's closely aligned between our committees, a lot of work that myself and Gemma have undertaken and my colleague Lee Allen as well. So there's crossover and membership of those subgroups, and that's included the Forth Valley Public Information and Engagement Group and the recent development of our Missing Persons Protocol that Roddy mentioned earlier also. So really the purpose of all this joint work as well, it leads to better information sharing, which is noted always as an area that comes out from a key area of learning from our learning reviews, but also improves the experiences of our children, young people, adults and families.
Thanks, Tony. So, as Tony said, there's been lots of work that we've been doing together over the last wee while, but what's next and why? So, we're really looking to have some focused time to look at the needs of vulnerable young people. What are their transitions and what are their pathways like? This is a local need, but it's a national need. There's lots of work looking at this nationally as well at the moment. There's more vulnerability at those times. Any times a transition in our life, there's uncertainty during those times, and for vulnerable young people, we really need to make sure that our practice is as strong as possible. We talk about relationship-based practice with our interventions with families. However, it's really making sure that we've got great relationships across services and across departments, from children, young people and adults, to make sure that we provide quality interventions. So we're really wanting to have a lot of joint work going forward, having a look at this in a bit more detail. The bit about why, so Tony had touched on it there around information sharing, poor communication and a lack of collaborative working. These are some of the things that can be, where there has been case reviews or learning reviews, these can be findings. And sometimes they've highlighted that there might be a young person who's transitioning between children and adult services, but the policies, the procedures, the legislation, the guidance, unfortunately sometimes they can get lost within that transition in those pathways. And actually there could be no material change to their needs and their risk of harm. However, they're not getting the same quality support, and we really don't want that to be the case in Falkirk. So we're dedicated to having a look at really bolstering and strengthening our work for vulnerable young people. Sometimes what can affect our quality interventions if there's a lack of shared understanding between children and adult services. Tony and I's role, and Tony mentioned Lynn there, Lee Allen, who's coming into the Child Protection Lead Officer role. One of the really important parts of our role is just around making sure that we're creating opportunities and fostering the right environment for people to get together, have those discussions, get to know each other and understand each other's roles. And that's why we've been doing so much jointly together in these joint forums, because it makes a huge difference. Just to comment, so I've mentioned they're local and national, and it's vitally important that we're connected nationally, as well as looking at our local needs as well. Really just going to touch on this here, folks, and I would encourage you to go and read and use this as a tool. It's a practical tool. This was published by Iris in April of this year. And it's really recognising that actually it can be confusing for practitioners, because we have an Adult Support and Protection Act which talks about 16 and above could be an adult at risk of harm, and then the National Child Protection Guidance talks about a child up to 18. So this national guidance is really looking at what does the landscape look like for legislation, policy and practice for practitioners trying to implement that on the ground for 16 and 17-year-olds. It's a really good read. There's a practical table in it which compares and contrasts the different powers and tools that can be used within each of the pieces of legislation. So we'd encourage you, and we'll certainly be using this when we're considering our approach and our work in this area going forward.
Thanks, Gemma. As Gemma just noted there, it's part of national discussions as well as local, acknowledging that at times it's described as quite a cluttered national policy landscape. Hence, there's never been more important time for us to be developing these good partnership working relations between adult services and children's services. So we have got, we now have national transitions guidance that encourages to take a joint approach to working together, developing a person-centred approaches that are rights-led, that are early and continuing, and addresses the inequalities that we have for many people in our society. The transitions guidance talks about how the term transitions can be interpreted in many different ways, can be multidimensional, complex, but the transition by its very nature is fluid, flexible, it's not fixed. It talks about how it can mean children moving between, or adults moving between care placements, moving on from family-based residential or secure arrangements and also highlights that some of these transitional phases can be the most isolating and risky phases of individuals' lives. They can be separated, through perhaps from parents, through imprisonment, often separated from people who they feel closest to, and when they need help most. It also talks about how transitions can involve periods of heightened and or predictable vulnerability, risks and needs. So really difficult phases of individuals' lives. They can be both physical and emotional, the changes they go through. And transition, the guidance notes, is both age and stage and development based. So we need to have that good understanding. Also highlights that transition should be trauma informed. It should be focused on vulnerability, on individual risks and needs. And again, going back to that person-centred approach and not about eligibility criteria is what it drives us to consider. Approaches that aren't system-centred. Highlights that our responses to transition should also be a process that unfolds over several months. It's not a one-off event. It's not a short, abrupt approach, or it shouldn't be. Also highlights that individuals can come across many different practitioners from different services, from the public, the private, the third sector. So all of that needs to be carefully planned, managed and coordinated. So that's hence why we have this national transitions guidance. Now, just before I pass back over to Gemma, there was one takeaway for myself. I'd attended a national conference of adult protection and child protection, and it really stuck with me. It was a comment that was made, and it was about hard borders are sometimes unhelpful. And often these transitional phases and interface between children's services and adult services, instead of it being a debate over who is responsible to respond and support children and adults, we should be reframing these situations as an opportunity for joint working and to improve our partnership responses. Thanks, Gemma.
Thanks, Tony. So we've looked at a bit of the national there, folks. This is our local guidance. It's across Forth Valley. This is available on the practitioner pages. It's just recently been refreshed by the Child and Adult Protection Lead Officers across Forth Valley. And this is our transition planning guidance for staff working with young people aged 16 to 18 in the area of adult and child protection. So it's been refreshed, so it's really important that you access that and you review the refresh and you apply that in your practice. But really, it picks up on a lot of the stuff that we've already covered here. It's about making sure that there's the right knowledge and understanding from practitioners, but also importantly, their managers, and having those good relationships and discussing things. And I couldn't agree with Tony more than what he says there around the hard borders is unhelpful, and actually seeing it as an opportunity to think about having those discussions, really thinking about, well, if it's maybe not for this or not for this, what are we going to do collectively to make sure that the needs of that young person are met. It's about that. It's about the right time, the right people, the right place, and for as long as they need it. So please access and review our guidance. We'll have refreshed it as lead officers, but what we anticipate as we're going to be looking into this area of work in a bit more detail, that it'll be enhanced further and it'll be bolstered further, and that's what we're really thinking about next, and a key bit of our work plan. Okay, so back to the polls, folks. Just to have a wee look at the data here. Just let me get these back up again. Okay, so I'm just going to launch another poll here, which is going to appear on your screen. So first of all, we're looking at child protection investigations. So this isn't a word cloud, this one. This is multiple choice and looking for you to select what you think's the correct answer here. So how many child protection investigations were carried out for children aged 16 to 18 and 22 to 23? So select what you think it is there and hit submit. And as I said previously, if you can't see it in the centre of your screen, you should be able to access it within the chat function. Okay, so we've got a few different percentages there. So 30% of people thought it was 100, 16 thought it was 20, 18 thought it was 10, and 36% of you thought it was 50. The correct answer was 10. So for that reporting year, and that child protection data is carried over an academic year, so there was a fairly low number of child protection investigations. We're just going to move on to look at the same for adult protection investigations. I'll just launch that one for you folks. Same thing again, it'll appear in your screen. If not, you can access it in the chat. Same again, select which one you think is the correct. So we're talking about different age range here. So we're looking at 16 to 18-year-olds for child protection investigation. We're looking at 18 to 24 years for the data here. And this is for 23 to 24. So 10, 6, 25 or 30. Okay, so hopefully I didn't close it too early for folks there. We've got 18% think it was 10, 32% thought it was 6, 35 for 25 and 15 for 30. The correct answer was 6. So a low number of actual adult protection investigations for this year group. So fairly low numbers for both of them. I don't think for a minute that that means that there aren't lots of really good interventions happening for young people and vulnerable young people across these age groups. But I think what it's representing is that perhaps a lot of the work is maybe it isn't using child protection or adult protection, but actually it's using other legislation just through GIRFIC and thinking about community care as well, or other bits of work. But I suppose what it raises for me is that we've maybe got a wee bit of a data gap. How do we find out about those interventions for people that aren't coming through our adult and child protection data? Because knowing about the local need and interventions that are going on place for this age group lets us understand. So I think that's something probably key for us in this part of work. Let me just get that away from the screen, folks. And just this slide here just sets it out. So just within some tables here, so you can see the percentages. This really provides you the percentages of the overall investigation. So you can see here it represents a low percentage of the statutory activity taking place. Okay. We're over to our final slide now, folks. Just really for us to summarise and recap here. Tony's going to start off here. We're going to sort of chop and change for this slide.
Great, thanks, Gemma. So exactly as Gemma said there, so I suppose the question is, what's next? You know, there's lots to do. There's national drivers in relation to our commitment to the promise, or looking at how we can develop our rights-led approaches. There's our national transitions guidance. There's the acknowledgement of that complex policy landscape that we've talked about briefly today as well. So again, a comment I made earlier, I think it still stands. If there was a time when we really needed to work in partnership to consider how we're applying our resources and prioritising our activities, to ensure we're doing what we can to protect children and adults from harm in Falkirk, and that time is certainly now. And we've been doing that, through our ongoing joint working across children and adult services. an increased focus on locality plan as well. So that's going to be something that's going to be a real focus moving forward, considering the needs of our local communities and also of our shared workforce, to ensure we've got a skilled and competent workforce to respond to those needs.
Thanks, Tony. I was just going to touch on our escalating concerns protocol here again, folks. We're just about to review this. So this is the newest subgroup of Adult Protection Committee. And what I didn't mention earlier on, this is a good example of the joint work of other committees. So the membership for this subgroup is made up from members of Adult Protection Committee and our Drug and Alcohol Partnership, because we do see the escalating concerns that there is a high level of substance use for the adults in need that are coming through and hitting our escalation thresholds. But what we are also seeing is that when compared with adult support and protection data, there is a much lower age range profile for adults in need. So the escalating concerns work is underpinned by the Forth Valley Harm Reduction Protocol, which many of you will be familiar with. It's available on the practitioner pages as well. And that sets out 2 escalation thresholds to really ensure that there aren't young people and adults who are repeatedly fallen below the thresholds for statutory intervention and perhaps adult protection. So it's about that prevention bit. So we're wondering whether actually through a review of that, and because there are a lot of 18 and 24-year-olds that are being represented because we carry out audits of this work, that how can we, when we refresh that protocol, maybe look at the membership of the subgroup, how can we make sure that actually we're really focusing on the needs of vulnerable young people and through this pathway and this work stream.
Thanks, Gemma. Just one more point. I know Jillian's probably champing at the bit to go into the questions and answers. I think finally just to note, I think Gemma, you covered that early in effective intervention. But again, just I suppose going back to your commitment to the promise, that families receive that scaffolding, the right support from the right people at the right time, just to highlight that. Moving forward, looking at how we can build on our strengths and really develop that whole systems approach that Kenneth talked about earlier.
Very last point, Jilly, just around what's next and where we maybe see an opportunity to really progress with this, as we'll know that within Falkirk we've got an initial response team for children's services. We're about to implement one for adult services through our access team, who we're importantly going to be co-located. So we're really thinking there's going to be some great opportunities for joint work between those teams. And now the adult side of it's going to be implemented just shortly. Thank you.
That's great. Thank you so much for sharing that, and we're quite happy that you took your one more thing. So that's great. So it's now over to asking questions. As I say, we've had questions posed to us prior to the session, and then we're going to take the opportunity to ask our chief officers. So firstly, Kenneth, I'll maybe come to yourself with one of the first questions. And what do you think will be the impact on public protection services as a consequence of continued cuts to budgets?
Okay, thank you, Jillian. Thanks for the question. And what I'd say is that from a local authority point of view, we know that none of our services are entirely exempt from savings, but I think we need to take a really balanced overview and consider both the potential short and long-term impacts of budget savings. And it's really important for us, particularly thinking of the latter, the long term, that we protect core functions and preventative spend wherever we can. And from my perspective, public protection is absolutely, a core function for us. So we need to deal with the reality of budget constraints, and that will mean, mitigating public protection risks in the face of the kind of budget constraints that we face. And that means better joint working, better strategic planning, better resource allocation, improved collaboration. And I suppose what we also then need to do is identify and prioritize the most critical public protection services that need to be maintained despite budget constraints, to focus our resources on these. And I do think that COG has a really important role in all of this, because when we're considering that budget position and our different responsibilities and budget pressures, it's really important that we don't take decisions which have negative impacts on partner agencies, or we avoid them whenever we can. So we need to talk about budgets in that shared space and how we can continue to, maximise the impact we have, maximise the positive outcomes that we're achieving. But I suppose my starting point is these are really critical services, and these are some of the last areas where we will look for budget savings. So in the context of the broader position with public finances, I reiterate my initial point that no one can be exempt. Thanks, Jillian.
Thank you for that. Francis, can I open it to yourself? Do you have anything to add to what Kenneth said?
Yeah, I think similarly, Jillian, and the NHS finds itself in a challenging financial position this year as well, as do a lot of the health boards across Scotland. We have quite a small team in child and adult protection and public protection across the NHS in Forth Valley, so it would be very, very difficult to eat into that. And as Kenneth said, there has been no suggestion that this would be any of the areas that we would be looking at the moment. We're looking at other areas where we can gain efficiencies rather than looking at anything that will have an impact on clinical or services. So public protection is part of our clinical service, and so that's not the area of our focus at the moment. But as Kenneth said, I don't think anything will be exempt from at least the lens to see if there are opportunities for efficiency. But at the moment, with such a small team, we're looking to potentially grow the team within Forth Valley. So that's a different challenge in trying to secure funding at a time of financial challenge.
Thanks, Francis. Roddy, anything to add from Police Scotland perspective?
Just to say, I really agree. I know going back a number of years when there was austerity in certain parts of the country, there could be a temptation to withdraw from some partnership working, which I just don't think is the right thing to do. Partnership working is about efficiency, and at times like that, more partnership working is important. And we're doing things like we've had a business analyst in for 4 weeks to look at our public protection processes to try and prepare us for where there might be budgets. And I think it will be challenging, and I think we just have to have one eye on the well-being of our people and make sure that we're monitoring that going forward.
Yeah, thanks, Roddy. And Roddy, the next question is directed to yourself. So just based on those financial elements, as well as the activity of our Scottish Government, etc., a lot of practitioners are saying there are too many competing demands being made on the workforce in relation to responding to the introduction of new and revised legislation, policy and guidance. What role or influence does the Chief Officer Group have in management government expectations and protecting the workforce?
Well, I think what we've got to do is, so we're consulted on new legislation, and I think what we have to do is not just comment simply on the legislation itself, but comment on the impact of the legislation. This is how much, if we are to do this additional thing, or if we're to do this current thing in a different way, it has the potential to cost this, or potentially, if there's no additional money, we maybe have to think differently about this or stand down. And when we respond, do it that way. And as Police Scotland, we are consulted, and then that would come out to divisions, and I would pass it out to the relevant people, so whether that was Barry as the DCI for PPU and DIs, and just make sure, the delivery of a lot of this legislation takes place in the partnership environment, and make sure we are taking heed of the sort of partnership arrangements, but just making sure we feed back in and saying, you know, here's our view on this legislation, but here's our view on the impact of the legislation, so that they're well sighted on what's happening and what will happen.
Yeah. Kenneth, would you have anything to add to Roddy's position?
Yeah, I mean, two things I'd like to say. I mean, firstly, I think from a Chief Officers Group perspective, there's a really important role for us in terms of protecting and supporting the workforce in navigating these challenges and demands associated with new legislation and policy changes, etc. I mean, my personal view, and I feel this quite strongly, I think we're in a position of imbalance at the moment in Scotland. This doesn't just apply to public protection, but it feels to me that the budget pressures have become incredibly intense, but the new demands haven't yet ceased or haven't yet slowed down. And so that puts us in a position of imbalance. And certainly from a local government perspective, we're having really robust conversations with civil servants and with ministers about how there needs to be a shift here, because otherwise I think we're just getting into a situation where, new policies and guidance and issues have been introduced. They'll create a public expectation, and as a public expectation, we simply won't be able to fulfill. So I think we need to be really quite on the front foot about that and make it very clear that we are in a position of imbalance, and we need to see that change.
Francis, would you say the Roddy and Kenneth ideas reflect NHS Scotland?
Yeah, I think given the conversation around the financial challenges as well as the policy direction, I think there is a view that from an NHS Scotland perspective, there is a need for reform in order to be able to do things differently to meet the needs of our populations in a different way. And I think the messaging and the opportunity to support and work with communities to try and develop what that looks like. NHS Forth Valley certainly is looking at a new strategic direction over the next few years in terms of that population health and value-based care. So trying to make sure that we align all of this work together with our partners to provide the best that we possibly can, but it might be a different provision from what people's expectations have been up until now.
That's great. And Francis, could I just stay with yourself and ask another question that's been raised is, what do you see as the key public protection priorities for people at end of life, and how do we address them? Again, based on that context with lower resources, etc.
Yeah, thanks, Jilly. I think one of the most important things in that question is that we work with the person and with their families in terms of making sure that those realistic conversations around realistic healthcare, where people are making shared decisions with the teams that are working with them, but also that the teams that are working with individuals at end of life are actually working across that interagency to make sure that we are providing the right level of support. So one of the other things that I talked about earlier is how we can make sure that we've got the right clinical input into those individuals, and we're trying to attract some leadership from our ageing and health consultants to try and support us to make those right decisions with families, but also making sure that any of the practitioners who are supporting the care of individuals at end of life have got the right knowledge and skills and abilities to identify any adult protection concerns and respond to those appropriately within that interagency kind of frame, supported by people like Jane Scaife and yourself to make sure that people do the right thing. So I think the importance of being able to identify vulnerability and the ability to provide the right level of care and have the right conversations with individuals is key to how we would take that work forward. Hopefully I've answered that, Jilly.
Yeah, no, that's great. Kenneth, was there anything that you would consider within the local authority as supporting that work?
I mean, I think the principles and the views that have been set out are absolutely the right ones. I don't think I have anything significant to add to that one, Jilly. Thanks.
Yeah. Roddy, putting you on the spot, do you have anything to add to that as well?
No, I wouldn't fall out with anything that's been said, but I don't have anything to add.
That's great. Now we do have some other questions, but I think we'll answer them and send them out. I'm conscious of time. We've only got 4 minutes left of our session today, and I really just wanted to take this opportunity to thank our chief officers and our lead officers for their attendance and also for the presentation they've provided today. Hopefully you've found it as interesting and as useful as I have. Also, thank you to you all for sharing some questions and for the comments that you've made in the side chat. Again, we'll look through that. Myself and others will have a look at that and see if we can ensure that, you know, if you've asked questions or if you've asked for information, which I see people have been responding to directly, but again, we'll see if we can do that over the coming weeks. We'll make sure that we address everything. As I said earlier on, the session has been recorded today and will be available within the practitioner web pages, which again, I see that Evelyn has posted earlier on in the chat function. But we will share this via an email to all those who have attended, and please share that on with colleagues going forward. The session will also, and I think maybe someone will have posted it in the chat, we do want an evaluation of an understanding how this has been for yourselves as one of our first webinars, and we do welcome people to make suggestions about other webinars that they would want in the future, how often would we like them, and what topics do we believe that we should focus on. And you'll see that the link that I've got here, there'll be a forums team link, as I say, it should be in the chat. I see everybody's actively making comments, so that's fantastic. Okay, so we have got 3 minutes. Hopefully, I'm not sure if anybody wants to come in with any final words, or we can just sign off and give everybody the gift of 2 minutes to themselves. We're all good? Yeah. Thank you so much, everybody, for attending. Take care then. Bye-bye.